Good day, everyone. Our study is entitled Effectiveness of Rhythmic Stabilization Proprioceptive Neuromuscular Facilitation versus Spinal Stabilization Exercises on Functional Mobility of Tricycle Drivers with Chronic Low Back Pain in Iloilo. We chose this topic because chronic low back pain is one of the most common health issues worldwide, and tricycle drivers are especially vulnerable due to the nature of their work. Our research compares two types of exercises, PNF rhythmic stabilization and spinal stabilization, to determine which is more effective in improving functional mobility. Chronic low back pain, or CLBP, is a musculoskeletal disorder that affects up to 1/3 of the global population. For many, this pain becomes persistent and disabling, often lasting for more than 12 weeks. It is the second leading cause of disability worldwide, contributing to reduced productivity, increased healthcare use, and a lower quality of life. Patients with CLBP also tend to have postural instability and impaired balance, making them more prone to falls. Proprioceptive neuromuscular facilitation, specifically rhythmic stabilization, is an intervention that uses isometric contractions to improve joint stability and neuromuscular control. Studies have shown that PNF can reduce pain and improve function, though its effects on balance remain uncertain. On the other hand, spinal stabilization exercises target deep trunk muscles to enhance lumbar stability and mobility. Both interventions have shown promise, but it is unclear which is more effective, particularly for high-risk groups like tricycle drivers. For the research problem, the problem addressed in this study is which is more effective between rhythmic stabilization PNF and spinal stabilization exercises in improving the functional mobility of tricycle drivers with chronic low back pain in Iloilo. This is important because drivers often continue working despite pain, which worsens their condition and affects their livelihood. For research objectives, our main objective is to compare the effectiveness of rhythmic stabilization PNF and spinal stabilization exercises in improving functional mobility. Specifically, we aim to describe the respondent's profile in terms of age, sex, and years of driving experience. Second, assess the pre- and post-test outcomes of drivers who underwent rhythmic stabilization PNF in terms of pain and functional mobility. Third, assess the pre- and the post-test outcomes of those who underwent spinal stabilization exercises. Fourth, determine whether there are significant differences in outcomes within and between the two groups. For the significance of the study, this study is significant for several groups. For tricycle drivers, it raises awareness on how CLBP affects their functional mobility and encourages them to seek proper care. For local government units, the results may help develop health programs and collaborations with rehabilitation centers for drivers' well-being. For physical therapists, this study provides data that can guide rehabilitation programs and preventive strategies specific to occupational drivers. For the scope and limitations, this study focuses only on licensed tricycle drivers in Iloilo who are clinically diagnosed with chronic low back pain. Standardized tools such as OSWAS-3 Disability Index and the Timed Up and Go test will be used to measure outcomes. It does not include drivers with recent surgeries, fractures, or neurological conditions. This way, we ensure that the study specifically targets those who can safely undergo the exercise interventions.
For the definition of important terms, first, chronic low back pain refers to persistent pain in the lower back region lasting for at least 3 months or longer. In this study, it pertains specifically to tricycle drivers whose work activities may affect their mobility. Second, functional mobility is the ability to move safely and independently in different environments to perform daily activities. For our participants, this means carrying out work-related and personal movements despite their pain. Third, proprioceptive neuromuscular facilitation, or PNF, is a stretching technique that improves muscle elasticity and range of motion. In this study, it is used as an intervention to enhance functional performance. Fourth, rhythmic stabilization refers to alternating isometric contractions against resistance with no intended motion. We will use this approach to help improve stability and function. Lastly, Spinal stabilization exercises are exercises targeting the deep trunk muscles, such as the transversus abdominis and multifidus, to improve lumbar stability and manage pain. Moving on to the review of related literature. Several studies have shown the effectiveness of PNF, especially rhythmic stabilization, in managing chronic low back pain. For instance, Alarbi et al. In 2021 reported that PNF significantly reduced pain and disability compared to other strengthening programs. Kim and Lee in 2021 also found that rhythmic stabilization training improved balance and disability outcomes better than general trunk exercises. Additionally, Rafik et al. In 2023 discovered that PNF patterns activated lumbar muscles more effectively than Swiss wall exercises. These findings support the idea that PNF, or rhythmic stabilization, is effective in improving both pain relief and functional outcomes. For spinal stabilization exercises, Golby et al. In 2006 showed that spinal stabilization provided long-term improvements in disability and quality of life compared to manual therapy. A recent meta-analysis by Dmitry Jivek in 2025 also reported that these exercises significantly reduce pain and disability scores among patients with chronic low back pain. Moreover, longer programs lasting 8 to 12 weeks were found to produce better results compared to short-term interventions. This means that spinal stabilization exercises are not only effective but also provide sustained benefits for individuals with chronic low back pain. Our study is guided by the biopsychosocial model of pain. This model explains that chronic low back pain is influenced by the biological, psychological, and social factors. Biological factors include prolonged sitting, poor posture, and exposure to vibration, which all cause stress on the spine. Psychological factors involve stress, anxiety, and fatigue, which heighten pain perception. Lastly, social factors include economic pressures, which force drivers to continue working despite their pain, as well as limited access to healthcare. By considering these three dimensions, our study justifies the use of exercise-based interventions like PNS and spinal stabilization to improve pain and mobility. For our conceptual framework, the independent variables are the two exercise interventions, which are the rhythmic stabilization PNF and spinal stabilization exercises. The dependent variables are pain and functional mobility, which will be measured using the Oswestry Disability Index and the Time Up and Go test. The framework shows that by applying either interventions, improve in trunk control, neuromuscular coordination are expected, leading to reduced pain and better mobility among tricycle drivers. For our hypothesis, first, there is a significant difference between the pre-test and post-test scores of tricycle drivers who underwent rhythmic stabilization PNF. Second, there is also a significant difference between the pre- and post-test scores of those who underwent spinal stabilization exercises. And third, there is significant difference in the post-test scores between two groups, meaning we aim to identify which intervention is more effective in improving pain and functional mobility.
So our study will use a quasi-experimental two-group pre-test and post-test design. We will divide participants into two groups, one undergoing rhythmic stabilization PNF and the other spinal stabilization exercises. Their pain and functional mobility will be measured before and after 6 weeks of intervention using standardized tests. For the setting of the study will be conducted in Barangay Bangkal, Alimujan, Iloilo. This location was chosen because of its high density of tricycle drivers and strong cooperation from transport associations, making it practical and relevant for our target population. For sampling, we will use purposive sampling. A total of 30 licensed tricycle drivers aged 25 to 60, clinically diagnosed with chronic low back pain, will be included. They will be divided equally into two groups, 15 in the PNF group and 15 in the spinal stabilization group. Participants with acute illness, recent surgery, or balance disorders will be excluded to avoid risk. To measure pain-related disability, we will use the Oswestry Disability Index, which is a valid and reliable tool. For functional mobility, we will use the Timed Up and Go test, which measures how long it takes a person to stand up, walk 3 meters, return, and sit down. These instruments provide objective measures for our outcomes. The study has 3 phases. In the pre-implementation phase, we will secure ethical clearance, recruit participants, and conduct baseline assessments, including demographics, pain levels, and mobility tests. Participants will then be randomly assigned into either the PNF or spinal stabilization group. In the implementation phase, both groups will undergo 6 weeks of exercise programs, with 3 sessions per week lasting 30 to 40 minutes. Group A will perform rhythmic stabilization PNF, while Group B will perform spinal stabilization exercises. All sessions will be supervised by a licensed physical therapist to ensure safety and consistency. In the post-implementation phase, we will reassess participants using the same tools, the ODI and the TUG test. We will then compare their pre-test and post-test results to evaluate improvements in pain and mobility. The data will be analyzed using SPSS. We will use descriptive statistics to summarize demographics and pair t-tests to compare pre- and post-test scores within each group. We will also set a significance level at 0.05, meaning results will be statistically significant if the p-value is below this threshold. To ensure credibility, we use peer-reviewed journals and systematic reviews as our main sources. The appendix includes supporting materials such as consent forms and assessment tools.